Dr. Sanjay Gupta, think you don't want to get vaccinated? Think again. As I waited to get my first shot, I remember thinking how completely ordinary, and how completely extraordinary, it was all at the same time. Here was a snippet of messenger RNA from the virus, delicately wrapped in a little lipid envelope and delivered to each of our bodies via 2 shots, spaced a few weeks apart. This mRNA would prompt each of us to manufacture a little piece of the coronavirus, which would in turn prompt our immune system to create antibodies and other immune cells in response. While the vaccines seemed to be created within months, whereas they normally take years, the technology behind this vaccine was actually the culmination of a couple of decades of work by some of the most brilliant minds in science and medicine. It quickly became clear the vaccines worked extraordinarily well and have the potential to truly revolutionize medicine beyond this pandemic. The more things change, the more they stay the same. 8 months ago, while I was waiting for my turn to get the shot, the headlines were about the surging numbers of cases, hospitals buckling under pressure, dire predictions for more of the same in the months to come, and the politics of mask wearing. Today, I'm heartbroken to read the same headlines: case numbers climbing, hospitals in some places inundated with patients, predictions of the worst is yet to come, and cries against mask mandates. And this time, vaccine mandates, too. I want to be clear, this was not inevitable. Even without vaccines, the country became far sicker than it should have. The vaccines were supposed to wrap us with near impenetrable armor and provide longer-lasting protection. Of course, armor only works if you wear it, and the same is true of vaccines. Among the states with some of the lowest rates of new cases per 100,000 people, you'll find many of them have among the highest rates of vaccination in the country, such as Vermont, New Hampshire, Maine, and Maryland. President Joe Biden's chief medical advisor, Dr. Anthony Fauci, and others warned this great vaccination divide would cleave the country in half, especially when coupled with the very transmissible Delta variant that has been sweeping the country.
You're going to have areas where the vaccine rate is high, where more than 70% of the population has received at least 1 dose. When you compare that with areas where you may have 35% of the people vaccinated, you clearly have a high risk of seeing these spikes in those selected areas, he said. Fauci called the situation entirely avoidable, entirely preventable. Vaccines protect us from getting sick. Worst to first. That's what desperately needs to happen if we're going to get this Delta variant put back in its place. But we still have to do better if we want to get this pandemic under control. Our average of 446,300 people getting their first shot each day is still well below our peak in mid-April, when an average of nearly 2 million people were doing so. As things stand now, there are about 140 million people in this country who have still not even gotten 1 shot, and of that, more than 90 million are age 12 and older and thus eligible to be vaccinated. Where's the rub? According to a Kaiser Family Foundation poll released in mid-July, concerns about side effects, the newness of the vaccine, and perceptions about not needing to get vaccinated were among the top reasons people gave for not getting their shot. So, let me try and address these one by one. These are the same conversations I have been having with my own neighbors and friends. As far as safety goes, more than 4 billion doses of coronavirus vaccines have been administered worldwide. In the United States alone, more than 347 million doses have been administered. These are some of the widely used medical products on the planet, and as a result there is a remarkable amount of real-world data. Throughout the vaccination campaigns, the number of side effects have been and remain consistently and extraordinarily low. The CDC is constantly searching for side effects. That is how the agency was able to confirm 28 cases of rare blood clots among the 8.7 million doses of the Johnson & Johnson vaccine administered in the US. The side effect monitoring system is very sensitive and the news has been good.
Overall, side effects have been minuscule. What is not minuscule is the number of deaths caused by COVID-19, more than 4.2 million deaths worldwide, including more than 610,000 here in the United States. To give an emergency use authorization, the FDA had asked for 2 months of data, whereas for full approval the agency requires 6 months' worth. There is also a review of manufacturing facilities and even discussion about how it will be marketed in the future. It is layers of complexity that can be agonizingly slow, but may also provide a layer of confidence in the process. I can't speak to a date when we intend to have this done. But what I can say is we are going to move with all due diligence to get the review done with our usual high quality, as rapidly as we can. Dr. Peter Marks, director of the FDA's Center for Biologics Evaluation and Research, told the Washington Post on Friday. We know how important it is for people to be able to get vaccinated. We know that there are students going back to college who would like to see a licensed vaccine before they get vaccinated. And we understand that, and we will work toward getting this across the finish line as rapidly as possible, he said. COVID-19 is a disease that wasn't known to us 20 months ago, but still became a leading cause of death in the US last year. Its closest competitor, heart disease, doesn't have a vaccine to prevent it, but COVID-19 does. And even though millions of people in the US have become infected with the coronavirus, and hundreds of thousands have died of COVID-19, there are still many pockets of the country where people feel they escaped the worst of the pandemic and no longer need to worry, or that they never had to worry in the first place. But the Delta variant has changed that calculation. Delta is unforgiving and will take advantage of even a quick chance encounter to infect. If you look at the data, the death rates and hospitalizations have plummeted over this spring and summer, but that is only part of the story. If you dig a bit deeper, there are alarming trends.
According to an analysis by the Kaiser Family Foundation, of about half the states, more than 95% of hospitalizations and deaths have been among unvaccinated people. That number now includes young and formerly healthy people, not just older Americans and those with underlying health conditions. The country is no longer being split into vaccinated and unvaccinated. It will quite simply be divided between vaccinated and infected. It is also why masks will once again be commonplace for a time. As we hopefully continue to increase vaccination rates, we want to simultaneously hit the brakes on viral transmission, and masks in high-risk areas are the most effective way to accomplish that. Masks, to help us bring viral transmission to low levels around the country, and high levels of vaccination to keep us there. One of the most common questions about the vaccine: what if I previously had COVID-19? It is a very fair question, and there is plenty of evidence showing that natural infection can provide good immunity. I want to be clear before I continue. By now you must realize that achieving immunity by naturally getting infected is a terrible idea and could land you in the hospital or worse. Vaccination is an exponentially safer way to achieve immunity. But the question you are likely asking is more nuanced. Do you still need a vaccine if you already had COVID-19? The official guidance from the CDC is yes. And here's why. Existing data provides evidence that the vaccine will provide more durable immunity, and may also be protective against future variants. These are always critically important metrics, and even more so now, as we deal with the Delta variant. Again, this isn't dismissing the immunity from a previous COVID-19 infection, but making the case that adding a vaccine will provide better protection going forward. While the United States recommends a full 2-dose course of the Pfizer-BioNTech or Moderna vaccines, some countries have recommended getting at least one shot in those with previously known COVID infections.
The rationale is the original infection provided the same initial immunity as the first shot of a vaccine, and then a second shot would act as a powerful booster. I try to do it all the time. For example, as I walk through my daily life, as an on-air correspondent, as a doctor, and in this space. I do it not only because I love my family, but because I love yours, as well.
Thank you for watching. Please subscribe